This is the second part of general pharmacology. The first topic here is first order kinetics. First order kinetics. A constant fraction of the drug in the body is eliminated per unit time. Per unit time, a constant fraction of the drug is eliminated. For example, assume drug A with plasma half-life of 1 hour following first order kinetics and having an initial concentration of 100 microgram per milliliter. Sorry, 100 microgram per milliliter. So the initial concentration is 100 microgram per milliliter. Half-life is 1 hour. So in 1 hour it will be reduced to half, that is 50 microgram per milliliter. Then in another 1 hour 50 will be reduced to half, that is 25 microgram per milliliter. That is a constant fraction. 1 by 2 fraction here is being eliminated per unit time, and the time is equal to plasma half-life here. If this concentration is increased to 200 microgram per milliliter, a constant fraction, that is 1 by 2, gets eliminated in unit time. After 1 hour, the concentration will be 100 microgram per milliliter. The rate of drug elimination is directly proportional to its plasma concentration. If plasma concentration is more, the rate of elimination will be more. The rate of drug elimination is directly proportional to the rate of drug elimination is directly proportional to the plasma concentration. The rate of drug elimination is directly proportional to the plasma concentration. The half-life of the drug following first order kinetics will always remain constant. The half-life will always remain constant. The drug will be almost completely eliminated in 4 to 5 plasma half-lives. Almost completely eliminated in 4 to 5 plasma half-lives if administered at a constant rate at each half-life. Most of the drugs follow first order kinetics. See, so first order kinetics में a constant fraction of the drug is eliminated per unit time. Okay, जैसे कि if the initial concentration is 100 microgram per milliliter, 1 hour में 1 by 2 fraction is reduced, that is 50 microgram per milliliter. Another 1 hour में it will reduce to 25 microgram per milliliter. So that means in per unit time, constant fraction of the drug is eliminated. Constant fraction. The rate of drug elimination is directly proportional to the plasma concentration. And for half-life and for first order kinetics, the half-life of the drug remains constant. The drug will be almost completely eliminated in 4 to 5 plasma half-lives at a constant rate if the drug is administered at a constant rate at each half-life. The drug will be almost completely eliminated in 4 to 5 plasma half-lives if administered at a constant rate at each half-life. Most of the drugs follow first order kinetics. Okay, so a constant fraction of the drug is eliminated per unit time. The rate of drug elimination is directly proportional to the plasma concentration. The half-life is constant. Most of the drug follows first order kinetics. Then we have zero order kinetics. A constant amount of drug in the body is eliminated per unit time. First order में a constant fraction was being eliminated. Zero order में a constant amount of drug is being eliminated per unit time. First order में constant fraction, zero order में constant amount. Zero order kinetics, a constant amount of the drug in the body is eliminated per unit time. For example, ethanol is eliminated from the body at the rate of about 10 milliliter per hour. So constant amount, that is 10 milliliter, is being removed per hour. So zero order kinetics में constant amount is removed per unit time. Assume a drug B with initial plasma concentration of 200 microgram per milliliter. It is eliminated at a constant rate of 100 microgram per unit time. Means suppose that 1 hour में it is removed 100, it is removed 10 microgram. The concentration will be 190 microgram per milliliter after 1 hour. So if in 1 hour 10 microgram is removed, after 1 hour the concentration will be 190 microgram per milliliter, and after another 1 hour the concentration will be 180 microgram per milliliter. See, after 10 hours means in 1 hour 10 microgram is removed, so in 10 hours 100 microgram will be removed, so 200 minus 100, that is 100 microgram per liter will remain after 10 hours. ठीक है, तो ज़ीरो ऑर्डर का मतलब a constant amount is being removed per unit time. Here in 1 hour 10 microgram is being removed, in 2 hours 20 microgram will be removed, in 10 hours 100 microgram will be removed. If this concentration is increased to 300 microgram per milliliter, concentration will become 290 microgram per milliliter after 1 hour, because 1 hour में 10 microgram will be removed, so it will become 300 to 290 microgram per milliliter. As a constant amount of 10 microgram per unit time is eliminated, the half-life increases to 15 hours. जैसे कि 300 को हाफ होने में, दैट इज़ 150 होने में 15 आवर लगेगा यहाँ पे. ठीक है, यहाँ पे जो हाफ लाइफ था दैट वाज 10 आवर. अगर 200 माइक्रोग्राम पर मिलीलीटर है कंसनट्रेशन, देन द हाफ लाइफ विल बी 10 आवर्स. अगर कंसनट्रेशन 300 माइक्रोग्राम पर मिलीलीटर है, देन द हाफ लाइफ विल इंक्रीज टू 15 आवर. Thus, zero order kinetics में half life is never constant. The half life of the drug following zero order kinetics is never constant. Zero order kinetics में half life कभी constant नहीं होता है. The rate of elimination is independent of the plasma drug concentration. The rate of elimination will always be same. It is independent of the plasma drug concentration. Okay. तो ज़ीरो ऑर्डर काइनेटिक्स में अ कांस्टेंट अमाउंट इज़ बीइंग एलिमिनेटेड पर यूनिट टाइम. ठीक है, और इसमें जो हाफ लाइफ होता है दैट इज़ नेवर कांस्टेंट. द रेट ऑफ एलिमिनेशन इज़ इंडिपेंडेंट ऑफ द प्लाज्मा ड्रग कंसंट्रेशन. ड्रग्स लाइक फेनिटोइन एंड एस्पिरिन at low doses follow first order kinetics. As the plasma concentration increases, elimination gets saturated, kinetics change over to zero order, that is saturation kinetics. So drugs like phenytoin and aspirin, at low doses they follow first order kinetics, and at high doses the elimination process gets saturated and the kinetics change to zero order. Drugs like phenytoin and aspirin at low dose follow first order kinetics. Phenytoin and aspirin follow first order kinetics at low dose. Okay, and as the concentration increases, the elimination process gets saturated and kinetics change to zero order. Phenytoin and aspirin at low dose they have first order kinetics. At high dose they have zero order kinetics, that is saturation kinetics. Phenytoin exhibits saturation kinetics as its plasma concentration has to be carefully monitored. That is phenytoin जो है वो saturation kinetics exhibit करता है, and its plasma concentration has to be carefully monitored. That is therapeutic drug monitoring. Okay, phenytoin का therapeutic drug monitoring करना पड़ता है when used in treatment of epilepsy. Phenytoin सैचुरेशन काइनेटिक्स फॉलो करता है, कम कम कंसनट्रेशन पे ये फर्स्ट ऑर्डर काइनेटिक्स फॉलो करेगा. एज द कंसनट्रेशन इंक्रीजेस इट फॉलोज सैचुरेशन काइनेटिक्स. ठीक है, और इसका थेरेप्यूटिक ड्रग मॉनिटरिंग करना पड़ता है व्हेन यूज्ड इन द treatment of epilepsy. Once the kinetics changes to zero order, an increase in dose will result in marked increase in the plasma concentration, leading to drug toxicity. So zero order kinetics में as the kinetics changes to zero order, an increase in the dose will result in marked increase in the plasma concentration leading to drug toxicity. ठीक है, जब जो काइनेटिक्स है वो ज़ीरो ऑर्डर फॉलो करता है, ठीक है, वो चेंज हो जाता है ज़ीरो ऑर्डर पे, देन एन इंक्रीज इन द डोज विल रिजल्ट इन marked increase in the plasma concentration leading to drug toxicity. So zero order kinetics में अगर वो चेंज करेगा फेनेटोइन का काइनेटिक्स, then the risk of drug toxicity is more. See, this is the plasma half-life. This is the plasma half-life of a drug after single intravenous injection. Single intravenous injection के बाद, ठीक है, this will be the graph, and steady state is achieved after approximately 4 to 5 half-lives during repeated administration at constant rate. तो सिंगल इंट्रावीनस इंजेक्शन के बाद दिस विल बी द ग्राफ, और रिपीटेड एडमिनिस्ट्रेशन एट कांस्टेंट रेट के बाद स्टीडी स्टेट इज अचीव्ड. सो दिस इज द ग्राफ आफ्टर सिंगल इंट्रावीनस इंजेक्शन, and this is the steady state that is achieved during repeated administration at a constant rate. Now let's see what is loading dose. Target level strategy. The dosage of a drug is calculated to achieve the desired plasma steady state concentration of the drug, which produces therapeutic effects with minimal side effects. Okay. एक ड्रग का डोसेज कैलकुलेट करते हैं ताकि डिज़ायर्ड प्लाज्मा स्टीडी स्टेट कंसंट्रेशन इज़ अचीव्ड. ठीक है, ड्रग का डोसेज डिसाइड करते हैं टू अचीव डिज़ायर्ड प्लाज्मा स्टीडी स्टेट concentration of the drug, and the steady state will produce therapeutic effect with minimal side effects. Loading dose. Initially, a large dose or series of doses of drug is given with the aim of rapidly attaining the target level in plasma. This is known as loading dose. So, initially, a large dose या series of dose is given with the aim of rapidly attaining the target level in plasma. This is known as loading dose. मतलब जो इनिशियल डोज होता है वो लार्ज होता है या सीरीज में देते हैं टू अचीव to rapidly attain the target level in the plasma. So initially large dose or series of doses of a drug is given with the aim of rapidly attaining the target level in plasma. This is known as loading dose. A loading dose is administered if the time taken to reach the steady state is relatively more. लोडिंग डोज कब ज़रूरी पड़ता है? जब द टाइम टू रीच स्टीडी स्टेट इज़ रिलेटिवली मोर एज कम्पेयर्ड टू द पेशेंट्स कंडीशन. लाइक हाफ लाइफ ऑफ लिग्नोकेन इज़ मोर देन 1 hour, so it takes more than 4 to 6 hours to reach the target concentration at steady state. When a patient has life-threatening ventricular arrhythmias after myocardial infarction, initially a large dose of lignocaine has to be given to achieve desired plasma concentration quickly. ठीक है, लोडिंग डोज का एक एग्जाम्पल हो गया लिग्नोकेन. लिग्नोकेन का हाफ लाइफ 1 hour होता है, तो स्टीडी स्टेट अचीव करने में इसको लगभग 4 to 5 हाफ लाइफ्स लग जाएंगे, दैट इज़ 4 to 6 hours लग जाएंगे टू अचीव द स्टीडी स्टेट. So when a patient is having life-threatening ventricular arrhythmias after myocardial infarction, Initially, a large dose of lignocaine has to be given to achieve the desired plasma concentration quickly. Okay, so when a patient is undergoing large life threatening ventricular arrhythmias after myocardial infarction, then a large dose of lignocaine has to be given to achieve the desired plasma concentration quickly. Once the plasma concentration is achieved, it is maintained by giving the drug as intravenous infusion. और एक बार वो डोज अचीव हो गया, वो स्टेडी स्टेट अचीव हो गया, then it has to be maintained by giving drug as intravenous infusion. ठीक है, तो लोडिंग डोज क्या होता है, एक इनिशियली एक लार्ज डोज या सीरीज ऑफ डोजेस देते हैं टू अचीव द plasma concentration, target plasma concentration rapidly. The aim is to achieve the aim is rapidly attaining the target level in plasma. लोडिंग डोज का रिक्वायरमेंट कब पड़ता है, जब स्टीडी स्टेट को अचीव होने में रिलेटिवली ज़्यादा टाइम लगे, जैसे कि लिग्नोकेन का हाफ लाइफ 1 आवर होता है, तो इट टेक्स 4 to 6 hours टू अचीव द टारगेट कंसनट्रेशन. इन केस ऑफ life threatening ventricular arrhythmias after MI, initially a large dose of lignocaine has to be given to achieve the desired plasma concentration quickly. ठीक है, फिर एक लोडिंग डोज को देने के बाद जब स्टेडी स्टेट अचीव हो जाता है, देन दैट इज मेंटेन्ड बाय गिविंग द ड्रग एज इंट्रावीनस इन्फ्यूजन. दिस इज नोन एज मेंटेनेंस डोज. Maintenance dose is the dose at which the dose of drug which is repeated at fixed intervals or given as continuous infusion to maintain target level in the plasma or steady state concentration is known as maintenance dose. So maintenance dose क्यों देते हैं, to maintain the steady state concentration or to maintain the target level in plasma. Okay, so the dose which is repeated at fixed intervals or given as continuous infusion to maintain the target level in plasma or steady state concentration is known as maintenance dose. The dose administered is equal to the dose eliminated in the dosing interval. Next topic, receptor families. ठीक है, तो 4 receptor families है. Ligand gated ion channels known as inotropic receptors. Ligand gated ion channels or inotropic receptors. G protein coupled receptors, GPCRs, or metabotropic receptors. Inotropic receptors, G protein coupled receptors or metabotropic receptors, enzymatic receptors, and receptor regulating gene expression, that is transcription factor or the nuclear receptors. There are 4 receptors family. First is ligand gated ion channels or inotropic receptors, then G protein coupled receptors or metabotropic receptors, enzymatic receptors, receptors regulating the gene expression, transcription factor or the nuclear factor. 4 receptors family: inotropic receptors or ligand gated ion channels, G protein coupled receptors or metabotropic receptors, enzymatic receptors or receptor regulating the gene expression, that is transcription factor, and nuclear receptors. Inotropic receptors, metabotropic receptors, enzymatic receptors, and nuclear receptors. So there are 4 receptor families: ligand gated ion channels, G protein coupled receptors, enzymatic receptors, and nuclear receptors. Location: ligand gated ion channels, G protein coupled receptors, enzymatic receptors are located on the membrane. Nuclear receptors are located intracellularly. Example, see effector. The effector of ligand gated ion channels are ion channels. Effector of GPCR is a channel or enzyme. Effector of GPCR is a channel or enzyme. Enzyme is the effector of enzymatic receptor, and gene transcription is the effector of nuclear receptor. Ion channels are the effector. Here channel or enzyme, here enzyme, and in case of nuclear receptors, gene transcription is the effector. Example of ligand gated ion channels: nicotinic, GABA A receptors. Nicotinic receptors and GABA A receptors are example of ligand gated ion channels. Nicotinic and GABA A are example of ion channels. The time required for response is milliseconds. Ligand gated ion channels, they are located on the membrane. The effector is ion channel, example nicotinic and GABA A receptors, and it takes milliseconds to response. G protein coupled receptors, location membrane, effector channel or enzyme, example muscarinic and adrenergic receptors. Muscarinic and adrenergic receptors are example of GPCR. Muscarinic and adrenergic receptors are example of GPCR. It takes seconds to response. GPCR located on membrane, effector is channel or enzymes, example of GPCR. Muscarinic receptors and adrenergic receptors, it takes seconds to response. Enzymatic receptors located on membrane, enzyme is the effector, example insulin epidermal growth factor receptor. Insulin epidermal growth factor receptor is an example of enzymatic receptor. Here enzyme is the effector. Insulin epidermal growth factor receptor is an example of enzyme receptor. Insulin epidermal growth factor receptor is an example of enzymatic receptor. It takes minutes to hours to response. Enzymatic receptors located on membrane, effector is enzyme, example insulin epidermal growth factor receptor. Insulin epidermal growth factor receptor is an example of a enzymatic receptor. It takes minutes to hours to respond. Nuclear receptors are located intracellularly. Gene transcription is the effector. Example steroid thyroid hormone receptors. Steroid and thyroid hormone receptors are example of nuclear receptor. It takes hours to respond. Okay, so milliseconds, seconds, minutes to hours, and hours. Milliseconds, seconds, minutes to hours, and the last is hours. Ligand gated ion channel, location membrane, effector ion channel, example nicotinic and GABA A receptors. It takes milliseconds to respond. G protein coupled receptors located on membrane, effector is channel or enzyme, example of GPCR muscarinic or adrenergic receptors. It takes seconds to response. Enzymatic receptors located on membrane, effector is enzyme, example insulin epidermal growth factor receptor. Insulin epidermal growth factor receptor is the example of enzymatic receptor. It takes minutes to hours to response. Enzymatic receptors takes minutes to hours to response. Insulin epidermal growth factor receptor is an example of enzymatic receptor. Nuclear receptors, location intracellular, effector gene transcription, example steroid and thyroid hormone receptors. It takes hours to response. See, ligand gated ion channels or inotropic receptors, example are nicotinic, NM or acetylcholine receptors at the neuromuscular junction. न्यूरोमस्कुलर जंक्शन पे जो एसिटाइल कोलिन के receptors होते हैं, that is the nicotinic receptors. Nicotinic receptor is an example of inotropic receptor. Muscarinic receptor is a GPCR. Nicotinic is a inotropic receptor. Muscarinic is a GPCR. Other examples: GABA and glutamate receptors in the CNS. Inotropic receptor, example nicotinic receptor, GABA receptors, glutamate receptors. Binding of the agonist to the inotropic receptors will open ion channels, flow of ions through the channels, hyperpolarization or depolarization that will result in tissue response. Binding of the agonist to the inotropic receptor opens the ion channels, flow of ions through the channel leads to hyperpolarization or depolarization and tissue response. Then G protein coupled receptors, GPCRs or metabotropic receptors. G protein couple receptors are transmembrane receptors which control cell function via adenylyl cyclase, phospholipase C, and ion channels. GPCRs, G protein couple receptors or metabotropic receptors. They are transmembrane receptors. They are transmembrane receptors which control cell function either through channels or enzymes like adenylyl cyclase, phospholipase C, or ion channels. They control the cell function via adenylyl cyclase, phospholipase C, or ion channels. They are coupled to intracellular effectors through G protein. G protein couple receptors are coupled to intracellular effectors through the G protein. They are coupled to the intracellular effectors by G protein. G protein are membrane proteins and have three subunit alpha, beta, and gamma. G protein have three subunit alpha, beta, and gamma, and with GDP protein bound to alpha subunit. So G proteins, they have three subunits alpha, beta, and gamma. The agonist that binds to the receptor is the first messenger. The agonist that binds to the receptor is the first messenger. The binding of the agonist results in formation or recruitment of molecules, that is second messengers. These second messengers initiate the signaling mechanism. So agonist के bind होने से second messengers या form होगा या recruit होगा, that will initiate the signaling mechanism. Example of second messengers are cyclic AMP, which is generated by adenylyl cyclase, cyclic GMP generated by guanylyl cyclase, calcium ions IP3DAG generated by phospholipase C, and nitric oxide. Example of second messenger cyclic AMP, cyclic GMP, calcium ions IP3DAG, and nitric oxide. Binding of agonist to the receptors will result in coupling of the G proteins to the receptor. Binding of agonist to receptors will result in coupling of the G protein to receptor. GDP bound to alpha subunit exchanges with GTP. See, binding of agonist to receptor. जो receptor है उससे agonist bind करता है. This results in coupling of G protein to the receptor. Agonist के bind करने से G protein का coupling होता है. The GDP bound at the alpha subunit exchanges with GTP. Dissociation of G protein subunits from occupied receptor. Alpha GTP also dissociates from the beta gamma subunit. Alpha GTP and beta gamma subunits are released. It binds to target enzyme or ion channels. Stimulation of GTP is associated with alpha subunit. GTP converted to GDP. Alpha subunit associate with beta gamma subunit. Then other effects produced depends on the type of G protein, GS, GI, or GQ, or GO, which associates with agonist occupied receptor. See, GPCR होता है, उससे एगोनिस्ट बाइंड करता है जिससे जी प्रोटीन का कपलिंग होगा. रिसेप्टर से एगोनिस्ट बाइंड किया, उस रिसेप्टर से जी प्रोटीन का कपलिंग होगा. GTP bound to the alpha subunit exchanges with GTP. Alpha subunit से जो GDP bound होता है, it exchanges with GTP. जो G प्रोटीन है उसका 3 सबयूनिट था, अल्फा, बीटा और गामा. G प्रोटीन का 3 सबयूनिट होता है. सो GDP bound to the alpha subunit exchanges with GTP. Dissociation of G protein subunits from the occupied receptor. ठीक है, G प्रोटीन का डिसोसिएशन होता है. अल्फा GTP also dissociates. Alpha GTP dissociates from the beta gamma subunit. तो alpha GTP and beta gamma subunits are released. It binds to the target enzyme or ion channels. Alpha, GTP, and beta gamma units are released. It binds to the target enzyme or ion channel. Effect is produced, which depends on the type of G protein. The types are GS, GI, GQ, or G0, which associates with the agonist occupied receptors. Then stimulation of GTP is associated with alpha subunit will convert GTP to GDP. The alpha subunit again associates with the beta gamma subunit. Stimulation of GTP is in the alpha subunit will convert GTP to GDP, and then alpha subunit associates with the beta gamma subunit. If it is GS type, it activates adenylyl cyclase that will release in the that will result in the increase in cyclic AMP. Example, beta adrenergic receptor. Beta adrenergic receptor is a GS. ठीक है, GS का स्टिमुलेशन के कारण एडेनाइलाइल साइक्लेज एक्टिवेट होता है. इट लीड्स टू इंक्रीज इन साइक्लिक AMP. एग्जाम्पल, बीटा एड्रेनर्जिक रिसेप्टर. GI के कारण एडेनाइलाइल साइक्लेज इनहिबिट होगा, डिक्रीज इन साइक्लिक AMP होगा. एग्जाम्पल, अल्फा 2 एड्रेनर्जिक रिसेप्टर्स इन द स्मूथ मसल्स. GQ के स्टिमुलेशन के कारण फोस्फोलाइपेज 3 एक्टिवेट होगा. ठीक है, GQ के कारण फोस्फोलाइपेज C एक्टिवेट होता है. IP3 और DAG विल इंक्रीज. एग्जाम्पल, मस्कारेनिक रिसेप्टर्स. और बीटा गामा, they can stimulate or inhibit enzyme and ion channels. Example, all GPCRs. तो GS के कारण साइक्लिक AMP का लेवल इंक्रीज होगा. बीटा एड्रेनर्जिक रिसेप्टर इज ए एग्जाम्पल ऑफ GS. GI के कारण एडेनाइलाइल साइक्लेज इनहिबिट होगा, साइक्लिक AMP का लेवल कम होगा. एग्जाम्पल, अल्फा 2 एड्रेनर्जिक रिसेप्टर्स इन स्मूथ मसल्स. बीटा adrenergic receptor GS, alpha 2 adrenergic receptors GI, and muscarinic receptors are example of GQ. GQ will stimulate phospholipase C that will result in increase in IP3 and DAG. Muscarinic receptor is an example of GQ. M1 receptor is an example of GQ. Beta adrenergic receptor example of GS. Alpha 2 adrenergic receptor example of GI, and muscarinic receptor example of GQ. Then the third type receptor is enzyme receptors, that is transmembrane enzyme linked receptors. Transmembrane enzyme linked receptors have enzymatic activity in the intracellular portion. Transmembrane enzyme linked receptors have enzymatic activity in their intracellular portion. The enzyme is mainly tyrosine kinase. Example, receptor tyrosine kinases for insulin, epidermal growth factor. ठीक है, transmembrane enzyme linked receptors have enzymatic activity in their intracellular portion. The enzyme is mainly tyrosine kinase. Example, receptor tyrosine kinase for insulin and epidermal growth factor. Binding of agonist, example, insulin to extracellular domain of the receptor. रिसेप्टर के एक्स्ट्रासेल्युलर डोमेन से इंसुलिन बाइंड करता है. दिस रिजल्ट्स इन डाइमराइजेशन ऑफ द रिसेप्टर. इंसुलिन के बाइंडिंग से द dimerization of the receptor happens. It stimulates the intrinsic kinase activity in the intracellular part of the receptor. इंट्रासेल्युलर पार्ट में इंट्रिंसिक काइनेज स्टिमुलेट होता है. एक्स्ट्रासेल्युलर डोमेन में एगोनिस्ट बाइंड करेगा. इट विल लीड टू डाइमराइजेशन ऑफ द रिसेप्टर. दिस स्टिमुलेट्स द इंट्रिंसिक काइनेज इन द इंट्रासेल्युलर पार्ट ऑफ द रिसेप्टर. स्टिमुलेट्स द intrinsic kinase in the intracellular part of the receptor. Phosphorylation of the tyrosine residues on the receptor and other intracellular protein when insulin or epidermal growth factor growth factor etc. are the agonist. ठीक है, तो इंट्रासेल्युलर पार्ट में जो इंट्रिंसिक काइनेज होता है वो स्टिमुलेट हो जाता है, ठीक है। एक्स्ट्रा सेल्यूलर डोमेन से एगोनिस्ट बाइंड करेगा, रिसेप्टर का डाइमराइजेशन होगा, इंट्रा सेल्यूलर पार्ट में जो इंट्रिंसिक काइनेज होता है वो स्टिमुलेट होता है। It leads to phosphorylation of the tyrosine residues on the receptor and other intracellular protein, ठीक है। तो इससे टायरोसिन रेसिड्यूज का फॉस्फोराइलेशन होता है। इंट्रिंसिक काइनेज के स्टिमुलेशन से जो टायरोसिन रेसिड्यूज होंगे उनका फॉस्फोराइलेशन होगा। इट एक्टिवेट्स द इंट्रासेल्युलर सिग्नलिंग पाथवे, जीन ट्रांसक्रिप्शन होगा, एंड देन देयर इज टिश्यू रिस्पॉन्स। Binding of the agonist to the extracellular domain of the receptor results in dimerization of the receptor. Intracellular part में जो intrinsic kinase है वो stimulate होगा. It will lead to phosphorylation of the tyrosine kinase. It activates the intracellular signaling pathway that activates gene transcription and results in tissue response. Transmembrane ZAC, that is Janus kinase, STAT, that is single transducer and activator of transcription receptor. Transmembrane JAK kinase, STAT stands for signal transducer and activator of transcription receptors. Example receptors for cytokines, growth hormones, etc. JAK kinase, JAK STAT receptor is for cytokines and growth hormone. These receptors do not have intrinsic enzymatic activity in their intracellular path. On activation, they dimerize followed by their binding to the kinase in the cytoplasm. JAK leads to it phosphorylates the tyrosine residues on the receptors, binding of the receptor to the STAT, which gets phosphorylated. JAK phosphorylates the tyrosine kinase on the receptor. Then binding of receptor to STATs, which gets phosphorylated. Dissociation of STAT from the receptor, it binds to gene to alter transcription. JAK causes it phosphorylates the tyrosine residues on the receptors. JAK phosphorylates the tyrosine residues on the receptors, binding of the receptor to STAT, which gets phosphorylated. STAT gets phosphorylated, dissociation of STAT from the receptor. It binds to the gene and alter the transcription. तो जो जैक स्टैट रिसेप्टर है, इट डज नॉट हैव इंट्रिंसिक एंजाइमेटिक एक्टिविटी इन द इंट्रासेल्युलर पार्ट. On activation, they dimerize followed by their binding to the kinase in the cytoplasm. JAK phosphorylates the tyrosine residues on the receptor, binding of the receptor to STAT, which gets phosphorylated. उसके बाद जो STAT है, it will dissociate from the receptor, bind to the gene to alter transcription. Next topic, dose response relationship. The pharmacological effect of a drug depends on its concentration at the site of action. एक ड्रग का क्या फार्माकोलॉजिकल इफेक्ट होगा, इट डिपेंड्स ऑन द कंसंट्रेशन ऑफ द ड्रग एट द साइट ऑफ एक्शन, which in turn is determined by the dose of the drug administered. Such a relationship is called dose response relationship. ठीक है, एक ड्रग का क्या फार्माकोलॉजिकल एक्शन होगा, इट डिपेंड्स ऑन द कंसंट्रेशन एट द साइट ऑफ द एक्शन. ठीक है, और ये जो कंसंट्रेशन है, दिस इज डिटरमाइंड बाय द डोज ऑफ द ड्रग एडमिनिस्टर्ड. Okay, so this is known as dose relationship, dose response relationship. डोज के कारण कंसंट्रेशन डिसाइड होगा एट द साइट ऑफ एक्शन, और उस कंसंट्रेशन के कारण रिस्पॉन्स होगा. सो दिस रिलेशनशिप इज नोन एज डोज रिस्पॉन्स रिलेशनशिप. टाइप्स ऑफ डोज रिस्पॉन्स कर्व. टाइप्स ऑफ डोज रिस्पॉन्स कर्व्स में देयर इज ग्रेडेड डोज रिस्पॉन्स and quantile dose response curve. Graded dose response. This curve, when plotted on a graph, takes the form of a rectangular hyperbola, whereas log dose response curve is sigmoid shape. ग्रेडेड डोज रिस्पॉन्स कर्व जो होता है दैट टेक्स द फॉर्म ऑफ अ रेक्टेंगुलर हाइपरबोला. ग्रेडेड डोज रिस्पॉन्स इज इन द शेप ऑफ रेक्टेंगुलर हाइपरबोला. और जो लॉग डोज रिस्पॉन्स कर्व होता है दैट इज लॉग DRC, दैट इज सिग्मॉइड शेप. Graded DRC is rectangular hyperbola in shape. Graded DRC is rectangular hyperbola in shape, and log DRC is sigmoid in shape. Quantal DRC: certain pharmacological effects which cannot be quantified but can only be said to present or absent, that is all or none, are called quantal responses. Example: a drug causing ovulation. तो कुछ फार्माकोलॉजिकल एक्टिविटीज़ है विच कैन नॉट बी क्वान्टिफाइड बट कैन ओनली बी सेड टू बी प्रेजेंट और एबसेंट, दैट इज़ ऑल और नन. ठीक है, कुछ फार्माकोलॉजिकल एक्टिविटीज़ को क्वान्टिफाई नहीं कर सकते. इट इज़ ईदर प्रेजेंट और एबसेंट, दैट इज़ ऑल और नन, एंड दिस इज़ नोन एज क्वांटल रिस्पॉन्सेज. एग्जाम्पल: ड्रग causing ovulation. It is an example of quantal response. Drug causing ovulation is an example of quantal response. See, therapeutic index or TI, it is an index of drug safety. Therapeutic index is an index of drug safety. It is equal to median lethal dose of the drug divided by medium effective dose of the drug. Therapeutic index is equal to median lethal dose of the drug and median effective dose of the drug. Median lethal dose of the drug divided by median effective dose of the drug. It is the ratio between median lethal dose of the drug to median effective dose. Lethal dose 50, LD50. It is the dose of the drug which is lethal for 50% of the population. ED50, it is the dose of the drug which produces the desired effect in 50% of the population. So TI is equals to LD50 by ED50, that is medium lethal dose of the drug and median effective dose of the drug. Higher the value of therapeutic index, safer is the drug. Example: penicillin G has a high therapeutic index. Digitalis, lithium, phenytoin have a narrow therapeutic index. Penicillin has a high therapeutic index, then lithium, digitalis, and phenytoin have a narrow therapeutic index. Penicillin G has a high therapeutic index. Digitalis, phenytoin, and lithium have a narrow therapeutic index. Next term is drug potency. The amount of drug required to produce a desired response is called potency of the drug. The amount of drug required to produce a desired response is called potency of the drug. Lower the dose required for a given response, more potent is the drug. If कम डोज में ही, कम अमाउंट में ही desired response produce हो रहा है, that means the drug is more potent. The amount of drug required to produce a desired response is known as the potency. अगर अमाउंट कम है मतलब पोटेंसी, वो ड्रग ज़्यादा पोटेंट होगा. एग्जाम्पल: analgesic dose of morphine is 10 milligram and that of पेटिडीन इज़ 100 milligram. ठीक है, तो मॉर्फिन का जो रिक्वायर्ड डोज है दैट इज़ 10 milligram. So the lower the dose required for a given response, more potent is the drug. So morphine is more potent than petidine. So therefore morphine is 10 times more potent than petidine as an analgesic. Okay, analgesic में analgesic dose of morphine is 10 milligram and that of petidine is 100 milligram. So morphine 10 milligram में ही वो desired response produce कर देता है. So morphine is 10 times more potent than petidine. Drug response curve of drug A, that is morphine, and drug B as an analgesic is compared. See, this is the potency, this is the graph of relative potency of the two drugs. ड्रग ए अपना रिस्पॉन्स कम डोज में ही प्रोड्यूस करता है. सो दैट्स वाई दिस इज मॉर्फिन. ठीक है, मॉर्फिन इज़ मोर पोटेंट, ये कम डोज में ही अपना रिस्पॉन्स प्रोड्यूस करता है, एंड दिस इज़ पेथिडीन. So this is the relative potency of the two drugs. Next term is efficacy. Drug efficacy is the maximum effect of a drug. Drug efficacy is the maximum effect of a drug. Morphine is more efficacious than aspirin as an analgesic. Okay, morphine जो है, it is more efficacious than aspirin. Drug efficacy is the maximum effect of a drug. Morphine is more efficacious than aspirin. See, this is the relative efficacy of two drugs. Morphine का maximal effect ज़्यादा होता है. So this is the graph for morphine, and this one for aspirin as an analgesic. So this is the graph showing relative efficacy of the two drug. Efficacy means the maximum effect of the drug. Efficacy is the maximum effect of a drug. Next term is therapeutic range. It is the range of concentration of the drug at which it produces desired response with minimal toxicity. Therapeutic range is the range of the concentration of a drug which produces desired response with minimal toxicity. See, so this is the dose response curve of therapeutic effect and adverse effect. This is the therapeutic effect, and this is for the adverse effect, and this is the therapeutic range. Okay, this is for therapeutic effect, this is for adverse effect, and this is the therapeutic range. So therapeutic range is the range of concentration at which the drug produces desired response with minimal toxicity. The range of concentration at which drug produces desired response with minimal toxicity. Next topic is combined effects of drug. A combination of two or more drugs can result in increase or decrease in the response. Increased responses में we have additive effect, potentiation and synergism. ठीक है, ड्रग को कंबाइन करने पे या तो उनका जो रिस्पॉन्स है वो इंक्रीज करेगा या डिक्रीज करेगा. इंक्रीज रिस्पॉन्सेस में तीन टर्म्स है: एडिटिव इफेक्ट, देन पोटेंशिएशन दैट इज सुप्रा एडिटिव, एंड synergism. So additive means effect of drug A plus B is equal to effect of drug A plus effect of drug B. Means simply it is added. Potentiation or supra-additive means effect of drug A plus B, that is combined A plus B, is more than effect of A plus effect of B. Let's see what is the meaning of synergism. When two or more drugs are administered simultaneously, their combined effect is greater than that elicited by the drug alone. So synergism means when two or more drugs are administered simultaneously, the combined effect is greater than elicited by either drug alone. That means example of synergism: sulfamethoxazole and trimethoprim. It means sulfamethoxazole और trimethoprim को कंबाइन करने से जो इफ़ेक्ट आता है दैट इज़ मोर देन if sulfamethoxazole is given individually or if trimethoprim is given individually. So synergism means sulfamethoxazole और trimethoprim को simultaneously एडमिनिस्टर करने पे इनका जो कंबाइंड इफेक्ट है दैट इज मोर देन द रिस्पॉन्स एलिसिटेड व्हेन either sulfamethoxazole is given alone or trimethoprim is given alone. So sulfamethoxazole or trimethoprim is an example of synergism. Another example of synergism: pyrimethamine plus sulfadoxine. Sulfamethoxazole plus trimethoprim is an example of synergism. It means when these two drugs are administered simultaneously, their combined effect is greater than that elicited by either drug alone. sulfamethoxazole plus trimethoprim. Another example of synergism, pyrimethamine plus sulfadoxine. Pyrimethamine plus sulfadoxine, it is an example of synergism. Pyrimethamine and sulfadoxine, it is an example of synergism. Sulfamethoxazole plus trimethoprim. Sulfamethoxazole plus trimethoprim. Sulfamethoxazole plus trimethoprim is an example of synergism. Pyrimethamine plus sulfadoxine is another example of synergism. Pyrimethamine plus sulfadoxine is other example of synergism. Sulfamethoxazole plus trimethoprim and pyrimethamine plus sulfadoxine. See, कॉम्बिनेशन ऑफ ड्रग्स के कारण डिक्रीज्ड रिस्पॉन्स भी हो सकता है, दैट इज ड्रग एंटागोनिज्म. ठीक है, in antagonism the effect of one drug is decreased or abolished in the presence of another drug. Example, physical antagonism, chemical antagonism, physiological or functional antagonism. Physical antagonism, chemical antagonism, physiological antagonism, and receptor antagonism. Receptor antagonism, the antagonist bind to the same receptor as the agonist and inhibits its effect. It can be competitive or non-competitive. So receptor antagonism का मतलब जो antagonist है, it binds to the same receptor as the agonist and inhibits its effect. Agonist और antagonist दोनों same receptor से bind करेगा और antagonist agonist के effect को inhibit करेगा. Receptor antagonism can be competitive or non-competitive. Competitive antagonism, equilibrium type. In competitive antagonism, both agonist and antagonist bind reversibly to the same site on the receptor. Competitive antagonism, equilibrium type. Competitive antagonism में both agonist and the antagonist bind reversibly to the same site on the receptor. Both agonist and antagonist bind to the same site reversibly on the receptor. For example, acetylcholine binds at the muscarinic receptor. Atropine also binds on the same site on the muscarinic receptors. So atropine is a competitive antagonist of acetylcholine. They bind to the same site of the muscarinic receptor. Atropine is a competitive antagonist of acetylcholine. Morphine is the agonist at opioid receptor. Naloxone is the antagonist. So naloxone is the competitive antagonist of morphine at the opioid receptor. Atropine is a competitive antagonist of acetylcholine at the muscarinic receptors, and naloxone is the competitive antagonist of opioids at the opioid receptors. Equilibrium type of competitive antagonism can be overcome. Okay? That means it is reversible by increasing the concentration of the agonist. So equilibrium type of competitive antagonism can be overcome by increasing the concentration of the agonist. The log DRC of the agonist shows a rightward parallel shift in presence of a competitive antagonist. जो log DRC है agonist का, it shows rightward parallel shift in presence of competitive antagonist. Competitive antagonist के presence में जो log DRC है, it shifts rightward parallelly. See, this is the receptor for agonist and this is the rightward parallel shift when competitive antagonist is there. So this is the graph for competitive antagonism. ठीक है, competitive antagonism में there is rightward parallel shift. Competitive antagonism में there is rightward parallel shift. Parallel shift in competitive antagonism. Then non-competitive antagonism, non-equilibrium antagonism. Let's see non-equilibrium antagonism क्या होता है. The antagonist bind to the same site on the receptor as agonist, but it is irreversible. अगर reversible है that is equilibrium type, और अगर irreversible है then that is non-equilibrium type. The antagonist forms strong covalent bond with the receptor. Example, phenoxybenzamine is an irreversible antagonist of adrenaline at the alpha receptor. नॉन इक्विलिब्रियम एंटागोनिज्म में जो एंटागोनिस्ट है वो इरिवर्सिबली बाइंड करता है एट द सेम साइट. ठीक है, और जो एंटागोनिस्ट है इट फॉर्म्स अ स्ट्रॉन्ग कोवेलेंट बॉन्ड विद द receptor. Example, phenoxybenzamine is an irreversible antagonist of adrenaline at the alpha receptor. Phenoxybenzamine is an irreversible antagonist of the adrenaline at the alpha receptor. Phenoxybenzamine is the irreversible antagonist of adrenaline at the alpha receptor. Second thing is non-competitive antagonism. The antagonist bind to different site on the receptor and prevents the agonist from interacting with the receptor. ठीक है, so non-competitive antagonism में the antagonist binds to different site on the same receptor. receptor same है but agonist और antagonist का site अलग होगा. In this type, the antagonistic effect cannot be overcome by increasing the concentration of the agonist. There is flattening of the DRC in non-competitive antagonism. Example, diazepam and butyquilline. Okay, so diazepam and butyquilline is an example of non-competitive antagonism. इसमें जो नॉन कॉम्पिटिटिव एंटागोनिस्ट है इट बाइंड्स एट द डिफरेंट साइट. ठीक है, एंड दिस कैन नॉट बी ओवरकम बाय इंक्रीजिंग द कंसंट्रेशन ऑफ द एगोनिस्ट. जो DRC कर्व है वो फ्लैट हो जाता है. एग्जाम्पल, डाइजीपाम एंड बिक्यूलिन. सी, दिस इज द नॉन कॉम्पिटिटिव एंटागोनिज्म. This is agonist alone. This is when agonist is combined with the non-competitive antagonist. ठीक है, जैसे जैसे ज़्यादा एंटागोनिस्ट कंबाइन हो रहा है वैसे वैसे ये और फ्लैट होगा. ये जो कर्व है, ठीक है, ये जो ग्राफ है ये वैसे वैसे और ये फ्लैट होगा. तो नॉन कॉम्पिटिटिव एंटागोनिस्ट के कारण जो ग्राफ होता है वो फ्लैट हो जाता है. ठीक है, नॉन कॉम्पिटिटिव एंटागोनिज्म के कारण जो ग्राफ है, जो कर्व है, दैट बिकम्स फ्लैट. Next topic is placebo effect. Placebo is a Latin term that means I will please. Placebo is a Latin term that means I will please. It is a dummy medicine having no pharmacological activity. Placebo means I will please. It is a dummy medicine and has no pharmacological activity. The effect produced by placebo is known as placebo effect. Sugar tablets and distilled water injections are used as placebos. ठीक है, sugar tablets and distilled water injections are used as placebos. ये placebo मतलब I will please. It is a dummy medicine which has no pharmacological action. The effect produced by placebo is known as placebo effect. Sugar tablets and distilled water injection are used as placebos. They are used as dummy medicines with no pharmacological actions. Placebos are used for relief of subjective symptoms like anxiety, headache, tremors, pains, and insomnia. Placebo are used for relief of subjective symptoms like anxiety, headache, tremors, पेन और इंसोमिया. एंजाइटी, हेडेक, ट्रेमोर्स, पेन और इंसोमिया को यूज़ करने के लिए प्लेसिबोज यूज़ करते हैं. प्लेसिबोज आर फॉर सब्जेक्टिव सिम्टम्स सच एज एंजाइटी, हेडेक, tremors, pain, and insomnia. Placebos are for subjective symptoms like anxiety, headache, tremors, pain, and insomnia. Placebos are used in clinical trials In order to minimize bias, placebos are used in clinical trials to minimize bias. तो दो यूज़ है, एक सब्जेक्टिव सिम्टम्स को ट्रीट करने के लिए और दूसरा ये क्लिनिकल ट्रायल्स में यूज़ होता है टू मिनिमाइज बायस. तो प्लेसेबो जो है इट इज़ अ साइकोलॉजिकल फैक्टर affecting modifying the drug response. Placebo is a psychological factor modifying the drug response. Personality of doctor as well as the patient can affect response to a drug. Some patients respond to inert dosage forms, that is placebo, in conditions like pain, bronchial asthma, and anxiety. So placebos they do not have a pharmacological action. They are inert dosage forms. Factors affecting placebo effect are patient factor, drug factor, and doctor factor. Factors affecting placebo effect are drug factor, patient factor, and doctor factor. Patient factors. Patients with neurotic symptoms often respond to placebos. Patients with neurotic symptoms often respond to placebo. Drug factor में the placebo response can be affected by physical presentation or route of administration of the drug. जो placebo response है that is affected by the physical presentation and route of administration of the drug. ड्रग के फिजिकल प्रेजेंटेशन से और ड्रग के रूट ऑफ एडमिनिस्ट्रेशन से placebo response can be affected. Example, colorful tablets such as red, blue, and green and injectable preparations give better placebo effect. Colorful tablets and injectable preparations give better placebo effect. Doctor factor, personality of the doctor, motivation, and way of instruction. Doctor patient relationship are important factors that also affect response to placebo. पेशेंट फैक्टर्स में जो न्यूरोटिक सिम्टम्स वाले पेशेंट होंगे दे रेस्पॉन्ड टू प्लेसेबो. ड्रग फैक्टर्स में ड्रग का फिजिकल प्रेजेंटेशन और रूट ऑफ एडमिनिस्ट्रेशन इट अफेक्ट्स प्लेसेबो. डॉक्टर फैक्टर में पर्सनालिटी ऑफ द डॉक्टर, मोटिवेशन, वे ऑफ इंस्ट्रक्शन and doctor patient relationships are important factors that can also affect response to placebo. Doctor का personality, motivation, way of interaction, and doctor patient relationship can also affect placebo. See, next topic is tolerance. Tolerance means the need of larger doses of a drug to produce a given response. Tolerance means need of larger doses of a drug to produce a given response. Tolerance is of two types, natural and acquired tolerance. Natural tolerance is again of two types, species tolerance and racial tolerance. Tolerance of two types, natural and acquired. Natural further of two types, species and racial. Mechanism of development of tolerance are pharmacokinetic tolerance or dispositional tolerance, pharmacodynamic tolerance or functional tolerance, cross tolerance, and tachyphylaxis. Four mechanisms of development of tolerance: pharmacokinetic tolerance or dispositional tolerance, pharmacodynamic tolerance or functional tolerance, cross tolerance, and tachyphylaxis. Four mechanisms of tolerance: pharmacokinetic or dispositional tolerance, pharmacodynamic or functional tolerance, cross tolerance, and tachyphylaxis. Tachy means rapid, phylaxis means protection. Okay. So tachyphylaxis is a mechanism of development of tolerance. Tachy means rapid, phylaxis means protection. Tachy means rapid, phylaxis means protection. Tachy means rapid, phylaxis means protection. So acute tolerance. Repeated use of drugs at short intervals may result in rapid decrease in the pharmacological response. This is known as tachyphylaxis or acute tolerance. Example, tyramine, ephedrine and amphetamine. ठीक है, तो कौन कौन से ड्रग tachyphylaxis या acute tolerance शो करते हैं? Tyramine, amphetamine and ephedrine. Tyramine, amphetamine and ephedrine, they show tachyphylaxis. Tachy means rapid, phylaxis means protection. Tachyphylaxis is also known as acute tolerance. So repeated use of certain drugs at short interval may repeat may result in rapid decrease in the pharmacological response. So अगर कोई एक ड्रग को रिपीटेड यूज़ कर रहे हैं एट शॉर्ट इंटरवल, इट विल रिजल्ट इन रैपिड डिक्रीज इन द फार्माकोलॉजिकल रिस्पॉन्स. ठीक है, repeated use of certain drugs at short intervals may result in rapid decrease in the pharmacological response. This is known as tachyphylaxis or acute tolerance. Example, tyramine, amphetamine and ephedrine. These drugs act by releasing noradrenaline from the adrenergic nerve endings. Repeated administration of the drug causes gradual depletion of the neurotransmitter and hence reduction in the response. तो टैकी का मतलब रैपिड होता है, फाइलैक्सिस का मतलब प्रोटेक्शन होता है. तो repeated use of certain drugs at short intervals may result in rapid decrease in their pharmacological response. This is known as tachyphylaxis or acute tolerance. Example of tachyphylaxis, tyramine, amphetamine and ephedrine. Tyramine, amphetamine and ephedrine are example of tachyphylaxis. Tyramine, amphetamine and ephedrine. These drugs act by releasing noradrenaline from the adrenergic nerve endings. ये जो drugs हैं, they release noradrenalines from the adrenergic nerve endings. इनके repeated administration के कारण there is gradual depletion of the neurotransmitter and hence reduction in the response. So tyramine, ephedrine and amphetamine are example of tachyphylaxis. ये जो ड्रग्स हैं दे रिलीज नॉर एड्रीनलिन फ्रॉम द एड्रीनर्जिक नर्व एंडिंग्स. ठीक है, इनके रिपीटेड यूज़ के कारण देयर विल बी ग्रेजुअल डिप्लीशन इन द न्यूरो ट्रांसमीटर एंड हेंस रिडक्शन इन द रिस्पॉन्स. दिस इज द ग्राफ फॉर tachyphylaxis. ठीक है, this is the effect of repeated doses of ephedrine on blood pressure. ठीक है, blood pressure धीरे धीरे कम हो रहा है, there is gradual decrease. This is tachyphylaxis. Tachyphylaxis is shown by drugs like ephedrine, amphetamine and tyramine. ठीक है, ये जो drugs होते हैं ये adrenergic nerve ending से noradrenaline रिलीज़ करवाते हैं, बट इनके रिपीटेड यूज़ के कारण जो न्यूरोट्रांसमीटर है वो ग्रेजुअली डिप्लीट करता है एंड दस देयर इज़ अ डिक्रीज इन देयर फार्माकोलॉजिकल रिस्पॉन्स. Next topic is rational use of medicines. According to WHO, rational use of medicine requires that patient receive medication appropriate to their clinical needs in doses that meet their own individual requirement for an adequate period of time at the lowest cost to them and their community. So, according to WHO, rational use of medicines require that patient receives medication appropriate to their clinical need in doses that meet their own individual requirements for adequate period of time and at lowest cost to them and their community. According to WHO, rational use of medicines means the patient receive medications appropriate to their clinical needs. The medication should be according to their clinical needs in doses that meet their own individual requirements for the adequate period of time at the lowest cost to them and their community. It should meet their clinical need. It should be in doses that is meeting their own individual requirement for adequate period of time at lowest cost to them and their community. So rational use of medicine means patient receive medication appropriate to their clinical needs in doses that meet their own individual requirements for a decade period of time at lowest cost to them and their community. It involves the administration of right drug, right dose, right duration, and right cost to the right patient. So, right drug should be there, the drug should be in right dose, given for right duration, at the right cost to the right patient. Right drug for right time, for right duration, at right dose, at the right cost to the right patient. Right drug at right dose for right duration at right cost to the right patient. Let's see the examples of irrational prescribing. Drugs not prescribed as per standard treatment guidelines. So, drugs not prescribed as per standard treatment guidelines. Unnecessary use of drugs like antibiotics for viral infection. Underuse of drugs, example, not prescribing ORS in acute diarrhea. So, drugs that are not prescribed as per the standard treatment guidelines. Unnecessary use of drugs like antibiotics are unnecessarily used for viral infection. Underuse of drugs like not prescribing ORS for acute diarrhea. Incorrect use of a drug, that is selection of wrong drug, use of incorrect route and dose for a drug. Incorrect use of drug, use of medicines with doubtful efficacy, example appetite stimulants. Prescribing banned drugs, example cisapride. Use of irrational combinations, example ampicillin and cloxacillin for staphylococcal infection. So this is use of irrational combination. Prescribing expensive medicines unnecessarily when cheaper or equally effective drugs are available, and polypharmacy. So examples of irrational prescribing are drugs not prescribed according to the standard treatment guidelines. Unnecessary use of drugs, example antibiotics for viral infection. Underuse of drug, that is not prescribing ORS for acute diarrhea. Incorrect use of drug, unnecessary underuse or incorrect use of drug, example selection of a wrong drug or use of incorrect route एंड डोज ऑफ ड्रग, या तो ड्रग ही रॉन्ग है या उसका डोज रॉन्ग है या उसका रूट इनकरेक्ट है. यूज़ ऑफ ड्रग्स विथ डाउटफुल एफिकेसी, एग्जाम्पल्स एपेटाइट स्टिमुलेंट्स. देन बैंड ड्रग्स का यूज़ करना, दिस इज़ ऑल्सो इरेशनल. जैसे सिसाप्राइड जैसे बैंड ड्रग्स का यूज़ करना इज़ एग्जाम्पल ऑफ इरेशनल प्रिस्क्राइबिंग. यूज़ ऑफ irrational combination, जैसे combining ampicillin and cloxacillin for staphylococcal infection. So ampicillin और cloxacillin दोनों को combine करना, it is an example of irrational combination. Then prescribing expensive medicines when cheaper medicines are available, and polypharmacy. So these are the examples of irrational prescribing. Not prescribing drugs according to the standard treatment guidelines. Unnecessary overuse or underuse or incorrect use of drugs. Okay. Then using banned drugs, prescribing banned drugs, prescribing irrational combinations, prescribing expensive medicines, and polypharmacy. These are examples of irrational prescribing. Hazards of irrational use: थेराप्यूटिक फेलियर हो सकता है, इंक्रीज्ड इंसिडेंस ऑफ एडवर्स ड्रग रिएक्शन, emergence of drug resistant microorganism, increase in cost of treatment, financial burden to the society, loss of patients faith in the doctor. तो अगर डॉक्टर एक्सपेंसिव मेडिसिन प्रिस्क्राइब कर रहा है जबकि चीपर मेडिसिन्स अवेलेबल है, तो इसके कारण ट्रीटमेंट का कॉस्ट इंक्रीज हो जाएगा. देयर विल बी फाइनेंशियल बर्डन टू द सोसाइटी. ठीक है, ट्रीटमेंट का कॉस्ट विल बी इंक्रीज्ड, देयर विल बी फाइनेंशियल बर्डन टू द सोसाइटी. There can be emergence to the drug resistant microorganism. It can result in increased incidence of adverse drug reactions, therapeutic failure, and loss of patients' faith in the doctor. Hazards of irrational use of drug, therapeutic failure, adverse drug reactions, emergence of drug resistant microorganisms, increase in the cost of treatment, financial burden to the society, loss of patients' faith in the doctor. Let's see rational prescribing by WHO. First, a diagnosis has to be made. The problem has to be defined. The therapeutic goals to be achieved. That is, relief of symptom, cure of symptom has to be set. The right drug, appropriate route, dose, duration of treatment has to be selected. Write a complete prescription. Proper instruction and information about the drug should be given, and monitor therapy. So rational prescribing में first diagnosis is made, then the problem is defined. A diagnosis is made, the problem has to be defined. The therapeutic goal has to be set. That is for relief or cure of the symptoms. The right drug at the right dose for the right route and the right duration has to be selected. Write a complete prescription. Proper instructions and information about the drug should be given, and monitor therapy. The next topic it is adverse effects. Adverse drug effects. Adverse effect is defined as any undesirable or unwanted effect of a drug. Adverse effect is defined as any undesirable or unwanted effect of a drug. The WHO suggested definition of adverse drug reaction and adverse events are as follows. So adverse effect का मतलब any undesirable or unwanted effect of a drug. Adverse effect means any unwanted or undesirable effect of a drug. ठीक है, दो टर्म्स है, एडवर्स एडीआर और एई. ठीक है, एडीआर स्टैंड्स फॉर एडवर्स ड्रग रिएक्शन and AE for adverse event. According to WHO, ADR means any response which is noxious, unintended, and which occurs at doses normally used in humans for prophylaxis, diagnosis, or therapy of the disease, or for modification of physiological function. So, adverse drug reaction is any response which is noxious, unintended, and which occurs at the dose normally used in humans. ADR, adverse drug reaction, is any response which is noxious or unintended and which occurs at the doses normal and which occurs at the doses normally used in the humans. ADR is any response which is noxious, unintended, and which occurs at doses normally used in humans for prophylaxis, diagnosis, or therapy of the diseases. For prophylaxis, diagnosis, and therapy of the disease, or for modification of the physiological function. ADR is any response which is noxious or unintended and which occurs at a dose normally used in humans. ADR is any response which is noxious or unintended and which occurs at the dose normally used in humans. ADR is any response which is noxious or unintended and which occurs at a dose normally used in humans for prophylaxis, diagnosis, and therapy of the disease or for modification of physiological function. AE stands for adverse event. Any untoward medical occurrence that may present during the treatment with a pharmaceutical product but which does not necessarily have causal relationship with the treatment. AE, that is adverse event, any untoward medical occurrence that may present during the treatment. Any untoward medical occurrence that may present during the treatment with a pharmaceutical product but does not necessarily has casual relationship with the treatment. मतलब जब एक फार्मास्यूटिकल प्रोडक्ट से ट्रीटमेंट हो रहा है उस टाइम अगर कोई अनटुवर्ड मेडिकल ऑकरेंस हो गया which does not necessarily have a causal relationship with the treatment is known as adverse event. So adverse event does not necessarily have a causal relationship with the treatment. Adverse event or AE is any untoward medical occurrence. Any untoward medical occurrence that may occur during the treatment with a pharmaceutical company, with a pharmaceutical product which does not necessarily have a causal relation with the treatment. So AE is any untoward medical occurrence that may present during the treatment with a pharmaceutical product but which does not necessarily has causal relationship with the treatment. AE does not necessarily have causal relationship with the treatment. Let's see the types of adverse drug reactions. दो टाइप के एडवर्स ड्रग रिएक्शंस होते हैं, प्रेडिक्टेबल एंड अनप्रेडिक्टेबल. प्रेडिक्टेबल रिएक्शंस आर टाइप ए और ऑगमेंटेड रिएक्शंस. Predictable reactions are type A or augmented reactions. Unpredictable reactions are type B और bizarre reactions. Adverse drug reactions का दो टाइप होता है, predictable और unpredictable. Predictable is type A or augmented reaction. Unpredictable is type B or bizarre reaction. Predictable reactions में we have side effects, secondary effects and toxic effects. एडवर्स ड्रग रिएक्शन दो टाइप का होता है, प्रेडिक्टेबल और अनप्रेडिक्टेबल. प्रेडिक्टेबल इज टाइप ए और ऑगमेंटेड रिएक्शन. प्रेडिक्टेबल रिएक्शन एग्जांपल साइड इफेक्ट, सेकेंडरी इफेक्ट एंड टॉक्सिक इफेक्ट. Side effect, secondary effect and toxic effects are example of predictable reaction. Side effects, these are unwanted pharmacological effects of a drug. Pharmacological effects of a drug that are seen with therapeutic doses. Example, atropine used in the treatment of heart block. Atropine used in the treatment of heart block also produces dryness of mouth, blurring of vision, urinary retention, etc., which are the side effect. Okay? The side effect is the unwanted pharmacological effect of the drug that are seen with the therapeutic dose. जैसे जब एट्रोपिन को थेराप्यूटिक डोज पे यूज़ करते हैं फॉर द ट्रीटमेंट ऑफ हार्ट ब्लॉक, तो वो कुछ अनवांटेड फार्माकोलॉजिकल इफेक्ट्स शो करता है, जैसे कि ड्राइनेस ऑफ माउथ, ब्लरिंग ऑफ विजन, यूरिनरी रिटेंशन. ठीक है, तो एट्रोपिन के साइड इफ़ेक्ट्स क्या हो गए? ब्लरिंग ऑफ विजन, ड्राइनेस ऑफ माउथ एंड यूरिनरी रिटेंशन. So side effects are the unwanted pharmacological effects of a drug that are seen with therapeutic doses. Side effects are the unwanted pharmacological effects of a drug that are seen with the therapeutic doses. Atropine is used for the treatment of heart block. Atropine used in the treatment of heart block. इसका side effects क्या होगा? Dryness of mouth, blurring of vision and urinary retention. Then unpredictable reactions में we have drug allergy. This cannot be predicted. Drug allergy भी चार टाइप के hypersensitivity reactions होते हैं. Then idiosyncrasy. Idiosyncrasy, it is usually a genetically determined abnormal reaction to the drug. ठीक है, तो idiosyncrasy, it is a unpredictable that is type B adverse drug reaction or bizarre adverse drug reaction. Idiosyncrasy, it is a type of adverse drug reaction. It is unpredictable reaction type B or bizarre reaction. Idiosyncrasy, it is usually a genetically determined abnormal reaction to the drug. Example, aplastic anemia caused by chloramphenicol. Aplastic anemia caused by chloramphenicol is an example of idiosyncrasy. Idiosyncrasy is usually a genetically determined abnormal reaction to the drug. Example, aplastic anemia caused by chloramphenicol. prolonged succinyl choline apnea, prolonged succinyl choline apnea, hemolytic anemia seen with primaquine and sulfonamides. Idiosyncrasy is a genetically determined abnormal reaction to the drug. Idiosyncrasy is a genetically determined abnormal reaction to the drug. Example: aplastic anemia caused by chloramphenicol, prolonged succinyl apnea, then hemolytic anemia seen with primaquine and sulfonamides. Idiosyncrasy is a type of adverse reaction. It is an unpredictable reaction. Idiosyncrasy is a genetically determined. Idiosyncrasy is a genetically determined abnormal reaction to drug. Example: primaquine और सल्फोनामाइड्स के कारण कुछ इंडिविजुअल्स में हीमोलाइटिक अनीमिया होता है, क्लोरमफेनिकोल के कारण एप्लास्टिक अनीमिया का होना एंड सक्सिनाइल कोलिन के कारण apnea होना. Idiosyncrasy is usually a genetically determined abnormal reaction to drug. Example: aplastic anemia caused by chloramphenicol, prolonged succinyl choline apnea, and hemolytic anemia seen with primaquine and sulfonamides. Then drug dependence. Okay. WHO defines drug dependence as a state, psychic, and sometimes also physical. Drug dependence is defined as a state, psychic, or sometimes also physical, resulting from the interaction between a living organism and a drug, characterized by behavioral and other responses that always include a compulsion to take the drug on a continuous or periodic basis in order to experience its psychic effects and sometimes to avoid the discomfort of its absence. ठीक है, तो ड्रग डिपेंडेंस किन ड्रग्स के लिए होता है? ड्रग्स लाइक ओपियोइड्स, अल्कोहल, बार्बिट्यूरेट्स, एम्फेटामाइन. WHO defined drug dependence as a state, psychic, and sometimes physical. Okay, and it is because of the interaction of a living organism and a drug. It is an interaction between the living organism and the drug, which is characterized by behavioral and other responses that include compulsion to take the drug on the time. The patient, the individual, will have the compulsion to take the drug on a continuous or periodic basis in order to experience its psychic effects and sometimes to avoid discomfort of its absence. Okay. Example: opioids, alcohol, or barbiturates or amphetamines. Opioids, alcohol, barbiturates और amphetamine से drug dependence होता है. ठीक है, the person will have a compulsion to take the drug on a continuous basis to experience the psychic effects or to avoid the discomfort. Drug dependence can be psychological or physical. Drug dependence can be psychological or physical. Physical dependence में there is withdrawal syndromes. So drug dependence इनके साथ दिखता है opioids, alcohol, barbiturates और amphetamine. Opioids, barbiturates, amphetamine, and it can be psychological or physical. The next term is pharmacovigilance. Pharmacovigilance. It is the science and activities relating to detection, assessment, understanding, and prevention of adverse effects or any other possible drug related problems. Pharmacovigilance, it is a science and activities relating to detection, assessment, understanding, and prevention of adverse effect or any other possible drug related problems. So pharmacovigilance, it is the science and activities relating to the detection, assessment, and understanding the prevention of adverse effects or any other possible drug related problems. So adverse effect और कोई भी drug related problems को detect, assess, understand और prevent करना, that comes under pharmacovigilance. Pharmacovigilance is the science and activities relating to detection, assessment, understanding, and prevention of adverse effects or any other possible drug related problems. ठीक है। ड्रग का एडवर्स इफेक्ट या ड्रग रिलेटेड प्रॉब्लम्स को डिटेक्ट, असेस, अंडरस्टैंड और प्रिवेंट करना, दैट इज फार्माकोविजिलेंस. द एम ऑफ फार्माकोविजिलेंस is to improve patient care and safety related to the use of drugs, promote rational use of medicines, develop regulations for use of drugs, and educate health care professionals about EDRs. ठीक है, तो फार्माकोविजिलेंस का एम क्या क्या है? टू इम्प्रूव पेशेंट केयर एंड सेफ्टी रिलेटेड टू यूज़ ऑफ ड्रग, टू प्रमोट रैशनल यूज़ ऑफ मेडिसिन, to develop regulations for use of drugs, and to educate the healthcare professionals about EDRs. Pharmacovigilance is the science and activities relating to the detection, assessment, understanding, and prevention of adverse effects or any other possible drug related problem. The aim of pharmacovigilance is to improve patient care and safety. ठीक है, पेशेंट केयर एंड सेफ्टी को इम्प्रूव करना रिलेटेड टू यूज़ ऑफ ड्रग, रैशनल यूज़ ऑफ ड्रग को प्रमोट करना, रेगुलेशंस फॉर यूज़ ऑफ ड्रग को डेवलप करना, एंड टू एजुकेट हेल्थ केयर प्रोफेशनल्स अबाउट EDRs. So what are the aims of pharmacovigilance? To improve patient care and safety related to use of drugs, to promote the rational use of medicines, to educate the healthcare professionals, to develop regulations for use of drugs. The aim of pharmacovigilance are improve patient care and safety, patient के care और safety को improve करना, to promote rational use of drugs, to develop regulations for use of drugs, and to educate healthcare professional about EDRs. Okay. The aim of pharmacovigilance is to improve patient care and safety regarding the use of drugs, to promote rational use of drugs, then to educate the healthcare professional about EDRs, and to make certain regulations for the use of drugs. The National Pharmacovigilance Center is located at Ghaziabad. The National Pharmacovigilance Center is located at Ghaziabad. The international center is Upasala Monitoring Center in Sweden. National Pharmacovigilance Center in Ghaziabad. International center is Upasala Monitoring Center in Sweden. Any healthcare professional like doctor, dentist, nurses, pharmacist can report a adverse drug event. Patients can also report ADRs. So ADRs can be reported by doctors, nurses, pharmacist, dentist, or even the patients. The last topic of general pharmacology is clinical trials. This is the last topic. Clinical trials. After completion of preclinical testing of the drug, the company files an investigational new drug application with the regulatory authority for the permission to test the drug in humans. So, after the completion of preclinical testing of the drug, the pharmaceutical company will file an investigational new drug application with the regularity authority for permission to test the drug in humans. पहले प्री क्लिनिकल टेस्टिंग होगा, प्री क्लिनिकल टेस्टिंग हो जाएगा, उसके बाद जो कंपनी है इट विल फाइल एन IND, दैट इज़ इन्वेस्टिगेशनल न्यू ड्रग एप्लीकेशन टू द रेगुलेटरी अथॉरिटी, ताकि ह्यूमंस में ट्रायल का परमिशन मिल सके. A drug should be scientifically and ethically evaluated by testing in human beings for safety and efficacy prior to its use in man for therapeutic purposes. So a drug should be scientifically and ethically evaluated. ठीक है, तो ये जो clinical trial है, it should be both scientifically and ethically. A drug should be scientifically and ethically evaluated by testing in human beings for safety and efficacy prior to its use in man for therapeutic purposes. तो therapeutic purposes के लिए use करने से पहले we need to test the safety and efficacy of drug. Such study in humans is known as clinical trials. ठीक है, तो थेराप्यूटिक यूज से पहले ह्यूमंस में वी नीड टू अंडरस्टैंड द सेफ्टी एंड एफिकेसी, वी नीड टू टेस्ट द सेफ्टी एंड एफिकेसी. Such study is known as clinical trial. The principle of bioethics should be upheld during the clinical trials. They include autonomy, beneficence, non maleficence, and justice. ठीक है, bioethics should be upheld during clinical trials. They include autonomy, beneficence, non non maleficence, and justice. Clinical trials are conducted in 4 phases, 1 to 4. Okay, bioethics should be upheld. There should be autonomy, beneficence, non maleficence, and justice. Autonomy, beneficence, non maleficence, and justice. It is conducted in 4 phases, 1 to 4. Usually, the information obtained from one phase is analyzed before proceeding to the next phase. So, एक phase से जो information मिला, that is analyzed before proceeding to the next phase. So, there are 4 phases. Phase 1, phase 2 is the therapeutic exploratory study. Phase 2 is therapeutic exploratory study. Phase 2 is therapeutic exploratory study. Phase 3 is therapeutic confirmation trial. Phase 4 is post marketing surveillance. तो जो क्लिनिकल ट्रायल्स होते हैं वो ह्यूमंस पे परफॉर्म होते हैं फॉर टेस्टिंग द सेफ्टी एंड एफिकेसी प्रायर टू द यूज़ इन ह्यूमंस फॉर थेराप्यूटिक पर्पस. 4 फेजेस होते हैं. फेज़ 1, फेज़ 2 इज़ थेराप्यूटिक एक्सप्लोरेटरी स्टडी. फेज़ 3 थेराप्यूटिक कन्फर्मेशनल ट्रायल. फेज़ 4 इज़ पोस्ट मार्केटिंग सर्विलेंस. फेज़ 1, फेज़ 2 इज़ therapeutic exploratory study. Phase 3 is therapeutic confirmation trial. Phase 4 is post marketing surveillance. Phase 1, this phase involves testing the drug in humans for the first time. It is carried out in 10 to 100 participants. This is usually carried out on healthy volunteers. For drugs with potential toxicity, example anti-cancer drug, phase 1 trials are carried out in cancer patients. ठीक है. The main objective of this phase is to determine safety of the drug and maximum tolerated dose. Pharmacokinetics and pharmacodynamic data can be obtained. It is usually carried out by a clinical pharmacologist. No blinding is done. That is open label study. So, phase 1 involves testing the drugs in human for the first time. फर्स्ट टाइम टेस्ट हो रहा है फेज़ 1 में, फर्स्ट टाइम टेस्ट हो रहा है ह्यूमंस में. दैट इज़ फेज़ 1. ठीक है. इट इज़ कैरीड आउट इन 100 पेशेंट्स, 10 to 100 पेशेंट्स में फेज़ 1 होता है ऑन हेल्दी वॉलेंटियर्स. 10 to 100 पेशेंट्स, 10 to 100 पार्टिसिपेंट्स विच आर हेल्दी वॉलेंटियर्स. फेज़ 1 जो है वो हेल्दी वॉलेंटियर्स में होता है. ठीक है. और कुछ ड्रग्स जैसे कि जो काफ़ी टॉक्सिक ड्रग्स हैं जैसे कि एंटी कैंसर ड्रग्स, उनको हम हेल्दी वॉलेंटियर्स में नहीं ट्राई करते. दे आर कैरीड आउट इन कैंसर पेशेंट्स. एंटी कैंसर ड्रग्स का फेज़ 1 ट्रायल इज़ डन इन कैंसर पेशेंट्स. द मेन ऑब्जेक्टिव ऑफ दिस फेज इज़ टू डिटरमाइन द सेफ्टी एंड द मैक्सिमम टॉलरेटेड डोजेस. फेज़ 1 से हम सेफ्टी और मैक्सिमम टॉलरेटेड डोज को डिटरमाइन करते हैं. फेज़ 1 से सेफ्टी और मैक्सिमम टॉलरेटेड डोज को डिटरमाइन करते हैं. फार्माकोकाइनेटिक एंड फार्माकोडायनामिक डेटा कैन ऑल्सो बी ऑब्टेन्ड एंड इट इज़ कैरीड आउट बाय अ clinical pharmacologist. No blinding is done, that is, it is a open label study. Phase 1, first time in humans, 10 to 100 patient, healthy volunteers. Certain drugs like anti-cancer drugs which are potentially very toxic, उनके लिए the trials are done in the cancer patients and not in healthy volunteers. The objective to determine safety and maximum tolerated doses. Then pharmacokinetic, pharmacodynamic data can also be obtained. Phase 1 usually carried out by a clinical pharmacologist. No blinding is done. It is a open label study. Phase 2 therapeutic exploratory study. It is carried out for the first time in patients. Phase 1 was carried out in healthy volunteers. Phase 2, that is therapeutic exploratory study, is carried out for the first time in patients with the target disease for which the drug is intended to be used. It is conducted in 50 to 500 patient. Phase 1 in 10 to 100, phase 2 in 50 to 500 patients, usually in 3-4 centers. The main objective of this phase is to assess the effectiveness of the drug and to determine the effective dose range. इसका phase 1 का objective था safety और maximum tolerated dose को determine करना. phase 2 का objective होता है effectiveness और इफेक्टिव डोज रेंज को डिटरमाइन करना. इफेक्टिवनेस और इफेक्टिव डोज रेंज को डिटरमाइन करना. फर्दर इवैल्यूएशन ऑफ safety and pharmacokinetics is also done. The study is randomized and control may be blinded. Phase 1 जो होता है that is not blinded, it is a open label study. Phase 2 that is therapeutic exploratory study ये patients में होता है. Phase 1 हेल्दी वॉलेंटियर्स में हो रहा था. फेज़ 1 10 to 100 पेशेंट्स में होता है. फेज़ 2 50 to 500 पेशेंट्स में होता है इन 3 to 4 centers. Objective of phase 2 to determine the effectiveness of the drug, to assess the effectiveness of the drug and the effective dose range. Okay. Further evaluation of safety and pharmacokinetics is also done, and this process may be blinded. Okay. Phase 1 was not blinded. Phase 2 may be blinded. Phase 3 is therapeutic confirmation trial. This aimed to confirm the efficacy of the drug in large number of patients of either sex. Phase 3 is to confirm the efficacy. Phase 2 was to assess the effectiveness, of the drug and to determine the effective dose range. Phase 3, that is therapeutic confirmation range, that is therapeutic confirmation trial. Phase 3 is to confirm the efficacy of the drug in large number of patients of either sex. It is conducted in multiple centers. Phase 2 was carried out in 50 to 500 patients in 2 to 3 centers, 3 to 4 centers. Phase 3, that is therapeutic confirmation trial, it is to confirm the efficacy of the drug. It is carried out in large numbers in either sex and it is conducted at multiple centers. It is generally randomized double blind comparative trial. So it is randomized and double blind comparative trial. Further data on kinetics and drug interactions can be obtained. Permission for marketing of the drug is granted after successful completion of the phase 3 trial. The phase 3 is a therapeutic confirmation trial. It aims to confirm the efficacy of the drug in large number of patients. Okay? Phase 1 10 to 100 patient, phase 10 to 100 healthy individuals, phase 2 50 to 500, phase 3 large number of patients of either sex. Phase 3 is conducted on multiple centers. Phase 2 in 3 to 4 centers. Phase 3 in multiple centers. It is generally randomized double blind comparative trial. ठीक है. Phase 1 जो था it was not blinded. Phase 2 may be blinded. Phase 3 is randomized double blind comparative trial. ठीक है. Further data on kinetics and drug interactions can be obtained. Permission for marketing is granted only after the successful completion of phase 3. Phase 3 में efficacy confirm करते हैं on a large number of patients of either sex, carried out in multiple centers, randomized double blinded comparative trial. ठीक है, एंड परमिशन फॉर मार्केटिंग ऑफ द ड्रग इज ग्रांटेड आफ्टर द सक्सेसफुल completion of the phase 3 trial. Then phase 4 is post marketing surveillance. Once the drug is approved for marketing, post marketing surveillance is carried out to obtain additional data about the benefit and risk of the drug following its long term use in large number of patients. तो एक बार ड्रग अप्रूव हो जाता है मार्केटिंग के लिए, देन पोस्ट मार्केटिंग सर्विलेंस इज डन. इससे हमको एडिशनल डेटा मिलेगा अबाउट द बेनिफिट एंड रिस्क following its long term use in a large number of patients. It provides information on adverse reactions, drug interactions, new indications, and evaluation of different formulations. पोस्ट मार्केटिंग सर्वेलेंस से हमें एडवर्स रिएक्शंस के बारे में, ड्रग इंटरैक्शंस के बारे में, न्यू इंडिकेशंस और इवैल्यूएशंस के बारे में पता चलता है. पोस्ट मार्केटिंग सर्वेलेंस हेल्प्स टू estimate the incidence of adverse reaction, detect previously unknown adverse reactions, and to identify risk factors for the adverse reactions. So post marketing surveillance से हमें adverse reaction का incidence estimate कर सकते हैं. We can detect the previously unknown adverse reaction, and we can identify the risk factors for adverse reactions. There are EDR monitoring centers in different parts of the country. The adverse drug reactions observed in patients should be reported to these centers. बहुत सारे ADR monitoring centers होते हैं, जो भी adverse drug reactions observe हुआ है वो इन centers को report करना चाहिए. The drug company has to submit post-marketing data for the drug at regular intervals to the regulatory agency to continue its use. तो जो ड्रग कंपनी है, इट हैज़ टू सेंड इट्स data, the post marketing surveillance data, at regular intervals to the regulatory authority to continue its use. Besides clinical trials, other type of clinical studies are case control study, cohort study, and meta analysis. Clinical studies के अलावा भी कुछ क्लिनिकल ट्रायल्स के अलावा भी कुछ क्लिनिकल स्टडीज़ होती हैं, जैसे कि कोहॉर्ट स्टडी, केस कंट्रोल स्टडी एंड मेटा एनालिसिस. सो फेज़ 4 इज़ पोस्ट मार्केटिंग सर्विलेंस. एक बार ड्रग अप्रूव हो जाता है मार्केटिंग के लिए, देन पोस्ट मार्केटिंग सर्विलेंस इज कैरीड आउट टू ऑब्टेन एडिशनल डेटा अबाउट द बेनिफिट एंड रिस्क ऑफ द ड्रग फॉलोइंग इट्स लॉन्ग टर्म यूज़ इन अ लार्ज नंबर ऑफ पेशेंट्स. पोस्ट मार्केटिंग सर्वेलेंस से हमें एडवर्स ड्रग रिएक्शन के बारे में, ड्रग इंटरैक्शंस के बारे में और न्यू इंडिकेशंस के बारे में पता चलता है. पोस्ट मार्केटिंग सर्वेलेंस प्रोवाइड इंफॉर्मेशन अबाउट एडवर्स ड्रग रिएक्शन, drug interactions, new indications, and evaluation of different formulations. Post-marketing surveillance help to estimate the incidence of adverse drug reactions, detect the previously unknown reactions, and to understand the risk factors. पोस्ट मार्केटिंग सर्वेलेंस से हम एडवर्स रिएक्शंस का इंसिडेंस एस्टिमेट कर सकते हैं. एडवर्स रिएक्शंस जो प्रीवियसली अननोन थे उनको डिटेक्ट कर सकते हैं, एंड वी कैन आइडेंटिफाई द रिस्क फैक्टर्स फॉर द एडवर्स रिएक्शंस. ठीक है, पोस्ट मार्केटिंग सर्वेलेंस से एडवर्स रिएक्शन का इंसिडेंस, प्रीवियसली अननोन एडवर्स रिएक्शंस और उनका रिस्क फैक्टर्स डिटेक्ट कर सकते हैं. काफ़ी सारे ADR मॉनिटरिंग सेंटर्स हैं. ठीक है, कोई भी अगर एडवर्स ड्रग रिएक्शन दिख रहा है, that should be reported to these centers, and the drug company has to submit its post marketing surveillance data for the drug at regular intervals to the regulatory authority to continue its use. So this was about general pharmacology.